If you're a physical therapist or occupational therapist trying to stay completely evidence-based in your clinic right now, I have sobering news. Back in 1950, the total amount of global medical knowledge took 50 years to double. Today, that rate has dropped to just 73 days. Right now, a new article is being published on PubMed every 30 seconds. Think about that. Research shows that it would take you 9 hours just to go through a small portion of that data which is being published for any medical specialty. It is literally impossible, and it's actually leading to evidence and medical burnout. If we haven't met yet, my name is Jay Bott, and I'm the co-founder of Jetset Rehab Education. And the core problem my team and I are trying to solve is how to keep clinicians evidence-based while also preventing burnout. Well, 50% of clinicians and physicians are doing this by utilizing a new AI tool called OpenEvidence. And today I'm going to show you how to go ahead and utilize that and more or less sharpen your clinical reasoning, help you with tougher cases, and more or less help you with your lit reviews. Join me as we go through OpenEvidence. Okay, so let's go ahead and look at a specific case. So I'm just going to keep it really broad, and we can go further and further into this. And the tool is pretty awesome. You can delve in further and further and get more and more information based upon how far down you want to go into this. Okay, and here we are on the OpenEvidence AI website. So this is the desktop version. Clearly they have a mobile version. So if you click over here, you can see that they actually have an app. And if you pan down to the bottom, I believe they talk a little bit about that it's available on iOS and Android. So you can kind of have it on your phone if you want to utilize it and just use it as a tool there. The thing that makes this platform so much different from like your classic ChatGPT or Gemini or even your other LLMs such as Claude, is this is really rooted in the evidence. So you can see they have signed content agreements here on top with the New England Journal of Medicine, the JAMA Network, the National Comprehensive Cancer Network, and even Cochrane Systematic Reviews. So just a lot of different resources. And then they've partnered with lots of different organizations. Now, from a therapy standpoint, I haven't seen anything like the American Occupational Therapy Association jump on board yet, or the APTA, but I would imagine as this continues to evolve, it's going to get stronger and stronger and broader. And you'll see as we type stuff in, you're going to be able to actually see that they have utilization for a physical or occupational therapist on a day-to-day basis. The other things to note, they have things such as medical calculators. So they have things such as BMI, Glasgow Coma scales, Wells DVT information, even a Berg Balance Scale. So those are the ones which more or less stuck out to me. But again, your practice may be different, and there may be other usage cases that you see in some of the medical calculators they have there. From a physician standpoint, it actually even tracks like how much you use it, and which articles you read. In which case it helps to provide CMEs. I'm not too totally versed on that because clearly it's not a CEU piece from a therapy standpoint. So I would encourage you, if you're a physician, to definitely look at that. And then for those of you who are familiar with Epic, they have more or less click on, and so I'll click on that. So they have some which are already in there. So after visit summaries, discharge instructions, FMLA. So these are various ones. And then there's stuff like in the community which have been created. And again, these are just ones which you can set up to help and kind of help navigate like day-to-day like operational stuff if you need to. So, again, lots and lots of different tools there. The big thing with OpenEvidence, for those of you who want to use it, you need an NPI number, so you can find that generally online. You're going to go ahead and look for that, or if you have one, you know what it is. You put that in, and you can sign up for the account. As for now, my understanding it is free, and I've been using it from a free standpoint, and it's been working well. The other piece that I would also say on this, they are HIPAA compliant, and so again, feel free to utilize that how you will. What I would tell you is I would fall back on whatever your organizational rules are on HIPAA compliance. Clearly, we don't want you guys getting into trouble for any PHI violations. So follow whatever your clinic organization does in regards to that if you want to enter specific information. I generally like to keep it very broad. I don't like to include any sort of information from that standpoint, but you can dial it into saying something like, hey, I have a 66-year-old with yada, 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 yada. And it will kind of help navigate that. You don't have to be very specific as to, hey, this is Mrs. Smith and this is what she has. So again, I'll leave that to you guys in regards to how you want to handle it. But that'll give you kind of a gist of what, at least some of the things I've noticed so far in my utilization of this. So let's see a couple of things on here in regards to guidelines. And then we'll also jump into just like a specific clinical case and how you utilize that, and we'll go from there. Okay, so let's go ahead and look at a specific case. So I'm just going to keep it really broad, and again, we can go further and further into this. And again, this tool is pretty awesome. You can delve in further and further and get more and more information based upon how far down you want to go into this. So let's just start out with something basic. As a need with that, and let's see what it gives us. So it's going to search this up, and again, a lot of your searches will be saved on this. So you can see they're going to give you the current guidelines. They're generally going to default to a lot of the like American Family Physicians, but you can see it goes right into the APTA, and it goes into the CPG data, which is the current clinical practice guidelines, which is what they utilize for things such as the OCS exam. So again, it gives you kind of the guidelines. It's going to give you kind of the things that you want to really focus on. In terms of eccentric exercise, resistance training, and then activity modification, where the night splints are. So it's going to give you lots and lots of data and information. And then if you go ahead and more or less scroll, it's going to give you the precise article as to what they were utilizing, and you can click on that, and then it'll take you to the site and kind of give you more information on that. Okay, so that's kind of some of the information. Now again, it's going to give you a high-level summary on some of this information. What I would encourage you to do, if you are a good consumer of research, and I've heard other professors say this, we really want to make sure that you're doing things to the highest level of care. So this is where you might have to do a little digging. Clearly there are limitations in current models. And so, what I would encourage you to do is, if you have further questions on like eccentric exercise, like what were the limitations of the study? Did they use enough people? Things of that nature. I would encourage you to actually pull up the article and be able to delve into this. But it does give you a high-level overview. Now, that being said, there is other things you can do to this. So, you can actually query it. So let's ask it a question. So let's say, for the eccentric were the limitations the studies. So let's see if it's able to give me that. I'm pretty sure it will. I've done this with a couple of other studies, but again, I would still encourage you as a clinician, if you have questions, to really delve back in. But here you go. It will tell you about the literature. There's several well-documented limitations across studies design, sample size, and generalizability. So here it's saying that again, eccentric exercises, the most of the RCTs have been small, and it's going to give you some of that information kind of again, really quickly. But again, you could see lack of blinding, exclusion of high risk populations. So you're going to get lots and lots of different bits on that if you're concerned about that. And again, you can just keep going down this rabbit hole and really trying to figure out what's going on. So I would encourage you to kind of play around with it and play around with different prompts. Prompts are really cool for AI. Again, depending on what you ask it, if you kind of keep it generic, it's going to really give you a broad answer. But if you're really specific about your prompts, and the better you get with your prompts, the better your outputs are going to be. So what I've heard from colleagues who utilize AI in general, garbage in, garbage out, right? So your prompts are really going to play a key role in how you get the data that you want to get. Now let's do one more thing. So we talked about just getting guidelines, and I was able to show you that. Let's start over here. And I'm going to say I have a 65-year-old with Achilles tendinopathy with let's do this, with history of diabetes, high blood pressure, and hyperlipidemia. Orthopedic physical therapist, and give me the optimal individual is sedentary. So you can make it more specific to a patient. So again, sometimes we're in clinics and I've seen this historically, no one's around, right? Or you have one other person and they maybe don't know the answer to your question. You can go on here and query it and it might be able to give you an answer. The beauty of this is, again, it's going to be rooted in the evidence, which again, should really springboard you into some better outcomes and better guidelines and such. So you could see that the cornerstone is eccentric loading program, but because you have comorbidities, right, which contribute to tendon pathology in this population, he's at threefold higher risk of tendon injury. You want to do a medication review, make sure he's not on chloroquine. So again, you can go into that. And then it's going to tell you kind of how to go about doing this. And it's telling us to do graduated eccentric loading, which makes sense given that this person may be on certain meds, and again, that the tendons are more apt to having difficulty with tears and things of that nature. And so you want to do more of a graded approach rather than just going in there and bombarding him and loading him. So again, this is just an idea of some things to think about: peripheral neuropathy screening, night splinting, avoiding prolonged aggressive exercise, and then it tells you kind of where the research falls on, if this conservative treatment fails. So again, hopefully that's helpful. This is just another way of really finding the data, but again, rooted in evidence, which I love, and something I think can really help your practice. So, let us know what you think. Drop some comments in the discussion below. More than happy to answer your guys' questions to the best that we know how. But the other thing I would also say, if you're interested, we have created like 4 to 5 prompts that you guys can use as therapists. I created a couple hand ones and some generalized physical therapy ones. Feel free to hit us up in the chat below, and we'll be sure to actually it's a link. Pop on that link, and we'll go ahead and send that out to you. Thanks. So hopefully this was valuable to all the healthcare professionals out there. For my rehab professionals, my PTs, my OTs, my chiropractors, and my ATCs, hopefully this can be utilized to help you manage your caseloads and even manage, bridge that gap, with regards to the evidence. For those of you who are interested, we did create a one-page PDF, which is basically prompts that you can utilize to help navigate the OpenEvidence website. Feel free to click on the link below, and we'll go ahead and send that out to you. The other thing I'd say is like and subscribe if you love our channel. We basically sell, rehab Con Ed courses in vacation destinations, and we invite you guys to stay after class. Until next time. Jetset. 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 Jetset.
Goodbye.